I want to know what they've already done to help themselves. By the time they get to see me, they may have seen many different physicians or disciplines of medical care. They've been to their primary care provider. They may have been to a neurologist or a gastroenterologist. Some of them have been to a chiropractor or an acupuncturist. I really want to know what they have already done to help themselves. I want to know what they think is causing the problem. Make no doubt about it. If a child has had a problem for 6 months, a year, or more, they have some pretty strong and insightful thoughts and feelings about what may or may not be going on with them. I want to know what makes it better. What do you do that makes it easier for you to be able to fall asleep, or make your headache pain less, or stop doing whatever habit is that might be going on? I want to know what makes it worse. I want to know if there's anything that they can't do because they have their symptom. And I also want to know if there's anything that they must do. That doesn't always fall into the category of obsessive compulsive disorders where they are driven to repeat an act. But there are some kids who, for example, can't go to school, won't go to school because they have symptoms. And there's other kids who think they just must go to the massage therapist or the nurse or the whatever, or sleep in their parents' bed, or whatever makes them feel better. So looking at that both ways, what can't you do, what do you have to do, can be helpful information. What do you hate the most about the fact that you still wet the bed at night, that you have headaches, that you have stomach aches, whatever the case is? And then I also want to know what other people have to say about it. What do your parents say? What do your friends say? What do you say about it? All gives me insight into their perspective. And then after we've gathered that information, we then set a goal and a plan for what we're going to be doing in the future. I'm now going to be interviewing Shelby as I might do in my own office. However, I would like to say that if I were in my own office, I would not be sitting this close to my patient, particularly if that patient was new to me. So there's some things we have to do for the camera, right, Shelby?
Mm-hmm.
All right. So why did you decide that it was necessary and important to come and see me today?
Well, I'm going into high school, and it's a brand new school for me, and it's always a little nerve-wracking for me.
It is nerve-wracking.
Yes.
I think when people do something new,
Mm-hmm.
it is anxiety-provoking for them.
Yeah.
And I know that in the past when you've had to do new things, you've experienced that
Yes.
before. Yeah. Let's zoom in and talk about it a little bit. When you think of the word anxious, you said it's anxiety-provoking for you. If you think about the word anxious, and you had to use that word in a vocabulary test at school, how would you define that word, Shelby?
Well, like being scared to like do different things and worrying about a lot of things.
Uh-huh. Okay. So it's feeling scared, worried,
Yep.
nervous,
Yeah.
right? All right. As you think about starting high school, which is a big step for people, what are some of the things that come to your mind about being in that place that kick up your worry, your anxiety?
Well, like not being in the same classes as my friends, and just like not knowing the teachers or where to go to each class,
Uh-huh.
things like that.
Uh-huh. So just kind of not knowing how it's going to work.
Yeah.
Right. As you think about that, is there anything in particular that feels the most worrisome or scary to you?
Not really.
Okay. So it's just all of that unknown stuff.
Yeah.
I just have to ask you one question about that. I know you do a bit of shopping. I know that from time to time you like to go to the mall, right?
Yeah.
Can you find your way around the mall?
Yeah.
Probably pretty well, huh?
Yeah.
How long do you think it took you to find your favorite store?
Probably a long time.
Oh, it took you a long time?
Yeah.
Oh, I was thinking, tell me it took you a short time. Because often, in fact, it just takes kids a day or two once they get to the high school and learn their way around. You're going to be a ninth grader, right?
Yep.
Okay. So there's 9 through 12 in that school building?
Just ninth graders.
Oh, just ninth graders?
Yes.
So you don't have to deal with all of those
No.
much older people. Well, that
No.
should help a little bit. huh?
Yeah.
Yeah. Okay. You have done some really excellent ways and thinking about how your brain works and how your body works. From one perspective, how it works in relation to where your attention is. Sometimes your attention is quite good, those things that you like to do. Other times it's been more problematic for you.
Yeah.
Can you talk just for a minute about that?
Well, when I'm having a hard time concentrating, my brain will be at my feet or at my tips of my toes.
That's far away.
Yeah. Or if it's just like a little bit here, can concentrate, and not so much there, it's probably be in my tummy.
Uh-huh.
And if it's really good, like I can concentrate a lot, it'd be in my head, like where it's supposed to be.
Yes?
So, yeah.
Yes. All right. Think for a moment and tell me about some of those things that you can focus and concentrate on with no problem.
What do you mean? Like, what do you mean?
Oh, well, you're a skater.
Yeah.
Do you have trouble focusing and concentrating when you skate?
Yeah, like when people are like talking or like just like standing by the boards, I can't really like do the things that I'm supposed to be doing.
Mm-hmm. Because you have a hard time keeping your attention just on that.
Yes.
Yeah. Are there things at school that you are able to focus and concentrate on much better than you are other things?
Sometimes and sometimes not. Like when people are talking and I'm trying to read like I'm supposed to, I
Mhm.
can't concentrate on what I'm reading.
Mm-hmm. Okay. Okay. And I would guess, tell me if this is true or not, but when you're having trouble focusing and concentrating, that kicks up your worry and your nervousness some as well.
A little bit, yeah.
A little bit. Yeah. Okay. As you start thinking about high school, how does it make your body feel?
Like shaky almost.
Shaky.
Yeah.
Yeah. Okay. Anything else?
My tummy gets a little upset and I get really nervous and anxious.
Uh-huh. Okay. So you get shaky, your tummy gets upset.
Mm-hmm.
Anything else?
Not so much, not really.
Not so much.
Yeah.
Okay.
That's really affecting me or anything.
Uh-huh.
Maybe a couple little things that come sometimes and sometimes not.
Uh-huh. Okay. Okay. I also know that science has been difficult for you.
Yeah.
Can you explain that, please? How has science been actually at times quite difficult for you?
Like life science, we're learning about like animals and plants. I'm afraid of reptiles and like reptile things.
Uh-huh.
So when they're talking about that, I just like get really nervous, and I
Uh-huh.
just can't be in the room when they're talking about that.
So you actually cannot be in the room.
Yeah.
Hmm. So that's one of the things that you cannot do
Yes.
because of this worry that you have. And I think that you actually made some arrangements to be out of the room when they were doing the chapter on snakes and
Mhm.
other reptiles, and then you figured out a way that you could do it by doing an extra project.
I was doing a report on turtles, which were a reptile, but I like turtles, so.
So it was an
worked.
okay one.
Yeah.
Yeah, yeah, okay. What do your parents say to you about your anxiety or your worry about going off to high school?
Well, we've been to the school to check it out first, so like my mom knows stuff and I know stuff, so we kind of work together to like figure out like what's exactly like bugging me about it, and we try and fix that.
Help me understand stuff. Can you give me one example?
Like not knowing like the counselor or the principal or things like that really need to like know.
Mm-hmm. Mm-hmm. Have you sat down with your mom, who I know is a big help for you, have you sat down with your mom yet and made a list of those things that might make you feel anxious or uncomfortable? Then you can actually start thinking about those things, or you haven't?
Not yet.
Not yet, you haven't done that. When does school start?
After Labor Day.
Okay, so good. Well, you've got more than a month, huh? You
Yeah.
don't have to think about that yet. Do you have friends that you talk to about how they're feeling about school?
Mm, a couple of my friends
Mm-hmm.
that are really good, close to me.
And what are they saying?
They're just saying like, oh, we could do this together. We'll see each other hopefully at lunch and in the hallways.
Uh-huh.
And so,
Quick question. Do those friends know and understand that some of these things make you very anxious?
yes.
Oh, they do. That's nice. That's nice. So you can reach out and they can be a support to you.
Yes.
Yeah. You have an older sister, don't you?
Yep.
Who has already been to ninth grade?
Yep.
So what does she say about this?
Nothing much. Just, it's a lot harder than 8th grade.
Uh-huh.
Yeah.
But she doesn't either berate you about it or
No.
give you advice about it, huh?
No.
No. Okay. So, have you already given some thought about if starting ninth grade was easier for you? Are there some things that you might want to have or practice or be ready for or think about?
Well, like when I get like nervous about something at school, I bring a little something. Like I collect pigs, so I bring a little pig with me and put it in like my locker or something.
Yes,
So
a
I
security blanket pig.
Yeah.
Okay, anything else?
Not really.
Okay, all right. And a little bit later in this interview, we're actually going to be demonstrating some of the mind-body skills and techniques that kids can use that we know can be helpful
Yeah.
for them. Okay? When I'm talking with children about what is happening with them, and particularly when they have a lot of physical symptoms, gathering some health history is extremely important. Your whole body is important to me, so I'm going to do what I call my David Letterman top 10, and that's a way of checking out your body from your head to your toe pretty fast. Some kids get so many headaches. They tell me they have trouble with their head. Do you get more headaches than you think a 13-year-old girl should have?
No.
All right. Are your eyes okay?
Yes.
Your nose okay?
Yep.
Do you have any allergies that I should know about?
Nope.
All right. The inside of your ears okay?
Yes.
I see you have braces on your teeth.
Yes.
Do they give you trouble when they
Yeah.
crank them down?
Yep.
Yeah, okay. Any trouble chewing or swallowing?
Nope.
Okay. Any trouble with your breathing down here, getting a breath, taking a deep breath?
Nope.
All right. Does your heartbeat feel okay?
Yep.
Good. Some kids get so many stomach aches, they tell me they have trouble with their stomach. Do you get stomach aches?
Only when I'm nervous.
Only when you're nervous. You're doing a great job right now. Okay. Do you have any trouble going to the bathroom?
Nope.
Okay. Do you have any trouble with your skin? Is your skin healthy?
Yes.
Okay. And how about the muscles of your body? Your arms, your legs, your back?
They only bug me when I skate and get tired.
Yeah, you're a skater, so sometimes you get...
Yeah.
Okay. Do you take any medicines every day?
I do.
What do you take?
I take Concerta 18 milligram and Zoloft.
That's right. That's right. Okay. And do you take any medicines occasionally?
No.
All right. Do you take any supplements, any vitamins or other kinds of supplements that I should know about?
Nope.
Great. How kids eat hugely influences their health, whether they like to think that or not, but it does. So let's talk about how you eat for a minute. Do you consider yourself a healthy eater, a picky eater, a junk food junkie?
A mix.
A mix.
Yeah.
Okay, so you have the healthy food and then you have the ice cream, right?
Yes.
That's the way it's supposed to be, right?
Yeah.
Do you eat all food groups? Milk and dairy products? Breads and grains?
Yep.
Some fruits and vegetables?
Yep.
Okay, and meats?
Yep.
Anything weird about your eating habits that I need to know about?
Nope.
You know, some kids have to line their food up in little rows, and
Yeah.
some kids are vegetarians or vegans, and then I got to know about that stuff. Great. What is your caffeine intake on an average day?
I don't like pop, so it doesn't really affect me, but I like chocolate, so.
Oh, well, everyone should have a little chocolate, don't you think?
Yep.
Isn't it the fifth food group?
Yeah. Yep.
Okay, so your eating habits are pretty healthy.
Yes.
That's hugely important, not only for your ADHD, by the way, but also in managing your worries.
Mhm.
The more steady you can keep your blood sugar, the healthier you'll be.
Okay.
Where do you sleep in your house?
In my room.
In your room. In your bed in your room?
Yup.
Okay.
In my room.
I asked that question, Shelby, because kids sleep all over houses. It's really kind of an interesting story. So when I ask kids about their sleep habits, I have a very set series of questions that goes like this. On a school night, what time do your parents think you should go to bed at night?
9.
What time do you actually put yourself in your bed, turn your light out, and say, I'm going to go to sleep now?
About 9:15.
Oh, you do it very quickly.
Yeah.
You're not one of those kids who climbs into bed and does instant messaging or watches
No.
TV or things like that.
No.
Okay. And what's your guess about how long it takes you to fall asleep?
20 to 30 minutes.
Okay. And that's actually an average length of time. When it takes kids more than an hour, then I worry that they're really struggling with being able to fall asleep. After you fall asleep, do you usually stay sleeping all the way till morning, or do you wake up in the night?
I stay asleep all night.
You stay asleep. Okay.
Mhm.
Are you a napper? Do you
No.
sleep in the day?
No.
Nah, I didn't think so. You don't look or act like a napper. So.
No.
Wonderful. Okay. And when you don't have to be in school, and you don't have to be doing homework, and you don't have to be cleaning your room, and you get to do just what you like to do, how do you spend your time?
I like to watch movies, and I like to bead. I bead a lot.
What does that mean, you bead a lot?
Like I make necklaces and
Ah.
bracelets and rings.
Ah. And then do you just keep them, or do you share them
I-
with your friends?
I
or-
keep them unless I'm making them for a friend, just to be nice.
Wonderful. So that's sort of one of the ways that you relax and perhaps get rid of some of your stress as well, huh?
Yep.
Great.